Very good evening, friends. Welcome to the seventh episode of Physio Samvaad. I'm waiting for the viewers to join in. Today we have something very interesting. So, Dr. Manish has already joined in. He is amazing. So, I just sent him a request. Hello, Vipin.
Hello.
Very good evening, Doc.
Good evening
How are
to
you?
you. Very good. Thank you, Dr. Sharma. How are you?
I'm amazing. Thank you so much, brother. It's a pleasure to have you with me.
I'm so grateful that you gave me this opportunity. Thank you so much. Thank you.
It's like already we have around 15 viewers with us, and we have so much of love and so much of people waiting for this seminar by you.
I'm very grateful to everybody who's joining in, spending time with us on this Wednesday evening, which is middle of the week in India, of course, everywhere. Middle of the day on a Wednesday. So
Let
thank you.
people join in. We are actually before time, so it's like the typical Dr. Sohrab and the Dr. Manish show. We are here before time.
Well, that's one thing that I've learned since I've come to England is they say if you're on time, you're late. So it's
Okay,
always
so you have
always
to be
better to
earlier.
be a
Early.
few minutes early.
Brother, when I take workshops, I guess I am the first one to reach the venue. It's like if the time is 9 o'clock, by 8:30 I'm at the venue and I'm arranging my laptop so that 9 o'clock I start firing.
You start, yeah, exactly. Yeah, that's one thing
So,
which shows your profession.
brother, it's like 23, 24, and 25 listeners right now, and
Sure.
people are joining in and they will join. And once it is around 5:30, uh,
Yeah,
I'll definitely start.
just give me a green signal and I'll start. I'm just going to be very basic on try
ब्रदर ये फिजियो संवाद जो है वो इसीलिए रखा मैंने बिकॉज आई हैव केप्ट द नेम संवाद इट्स अबाउट मी एंड यू कन्वर्सिंग विद ईच अदर एंड लेटिंग पीपल नो द बेसिक concepts
perfect.
because these are hands-on techniques and without the basic hands-on stuff knowledge you cannot
True,
perform it, but you
true.
have to have an overview of the things to understand it.
Very
So
true.
what
Very
I
true.
felt in India is most of the physios do not like to converse with each other. They are sitting in their own environment and they're not sharing the techniques or their
Yeah,
viewpoints.
yeah.
So that is why I started with this concept of talking to physios, those who have gained so much of knowledge and experience through their hard work and have been able to achieve so much of success. So
True.
all the juniors, all the students who want to learn can learn from the experiences of other physios. So it's an opportunity. It's a nice way of uh, talking to people like you.
Sure. Thank you.
And
There's one more thing I
I
would like
hope
to add is in the company that I work for, we're about 20 physios together. So once in a
wow.
month, we get together and one of us will do a in-service training. So for example, I choose one topic, knee joint or dry needling or whatever, and then we talk about the topic for an hour. It's an interactive session, just like you said, but it's imparting
Right. And
your expertise,
that
your knowledge.
actually helps to understand what is going on and
True,
some new ideas or some new protocols or some new SOPs, guidelines can be made for the patients.
true,
So
true.
standard operating procedures can be made out of discussions like this, what we need to do or
Yeah,
how we need to go about a case. Because there are certain issues that when you go practically about it, then only you are able to understand that. Because there is a difference between the books and the actual patient that comes to your clinic.
hello. Yeah,
Yes,
sorry,
yes,
I
brother,
lost
it's
you.
audible.
Sorry,
Now
I lost.
we are getting some amazing comments. We are starting to have around 30 viewers right now.
That's great.
I'll request the viewers to share it with their friends so that they can join in this. live session, and they also can. We will also share this content on the YouTube as well, brother. So afterwards, people can see to it.
Sure, that'll be great.
So let me formally introduce Dr. Manish. He is one of the most senior guys in UK. He is doing amazing job in the field of physiotherapy, and he is MSPT Neuro, and he is a wonderful clinician, having interests in so many varied things other than physiotherapy. He is also a doctor of homeopathy, but he has also gained a lot of knowledge about acupuncture, and still he is MSPT Neuro and has plenty of work done on the dry needling technique. So I welcome Dr. Manish.
Thank
Thank
you
you
so
so
much.
much for accepting my invitation.
My
You
pleasure.
are bearing the Indian flag in UK, and that's a proud moment for us.
Very high, very high.
Thank you so
You know,
much, bro.
I think about 45% of healthcare workers, including doctors, are from India, Pakistan, I would say, in the UK.
Wow,
So yeah, we are holding it very high. We are holding it very high.
that's so nice to hear, because many of the physios in India do aspire to be stationed abroad, and they want to relocate to other countries. So at the end of session, I'll request you to share your experience and the way one can approach while going abroad, what we need to check, and what's the procedure all about.
Sure,
So
I'll
yeah,
be very happy to share.
your experience will help all these budding physios to gain this knowledge about how to relocate themselves to greener areas. So
Anytime.
people have rose, the number is risen to 42. So I request people will keep on increasing, because I request my team members to kindly share this link to all the physios, to share to other people, so that they can have this wonderful session by Dr. Manish about dry needling techniques. He is going to take the introduction, how the techniques goes, what is the technique, and if you have any queries, you can ask him. And sir, Manish sir, you can see the number of hearts we are getting right now. It's
Yes,
it's
loads,
like
loads of
flowing
love.
in.
Thank you so much.
So, brother, what is dry needling? Let's come on the topic. Now, what is dry needling, and what is the technique all about? How it generated? How it originated? Is it the form of acupuncture? What is it? Can you just explain how you want to go about it? It's your platform now.
Sure, thank you, Dr. Sharma. I think this is one of the most commonest questions that will be asked to you when you're performing needling on a client. So get ready to answer this. They will first ask you, what is the difference between acupuncture and dry needling? So the difference is everything is different excepting the tool we use. So
Okay.
acupuncture is based on energy, meridians. It's a different ball game entirely. It doesn't coincide with modern medicine. So when you're learning Chinese acupuncture, you have to keep your modern medical brain aside, because everything is very different over there. So it's all energy based. It is very specific locations. There is an overlap of acupuncture points and dry needling points. There's a lot of overlap on it. But as I said, the only commonality is the tool that we use, that is our needle. Now, in about 1940s, there were two physicians who started experimenting. They were called Dr. Janet Travel and Dr. David Simons. They started experimenting with injecting stuff into muscular pain, because the lady, Dr. Janet, she was suffering from, I think, shoulder pain, and she was not getting rid of it. She tried many things. I think she was a cardiologist. So she found that there was lots of people who were not presenting with any cardiac pathology, but they were still having this referred pain kind of stuff. So she started injecting, shoulder muscles and muscles around the chest with some, saline and corticosteroids, some pain relieving stuff. And that's how it started. So that the origin is about 1940, but that was not dry needling. It was called wet needling because they were injecting stuff. Then in about 1979, there was another physician called Dr. Lewitt. He was a Czech physician, and he started doing, just needles, plain simple needles. He started experimenting with injecting stuff and then doing dry needles, just needles. And he came to a conclusion that there was no difference between the effect. So the effect is coming from the needle and not from the stuff that is injected into it.
Okay.
Thereafter, there was a lot of research. There is a lot of research. Unfortunately, the research is only in the West. India is lagging behind in this. That was one of the reasons why I wanted to bring up this topic, because I've seen that when even over here, when I'm trying to convince people, you have to convince them sometimes. Not the people from here, but mainly from Indian origin. You have to convince them to let me do dry needling on them because it is beneficial. It is helpful to them. It'll be
Right. People are scared of needles and stuff.
Yes. More than being scared, they're skeptical. Will it work? Is it just a sham? Is it just putting needles in and nothing's going to happen? I think we physios are the people who can bring it up. We can educate people about this, and we can bring this.
Physio Samvaad is one of the way of doing so. People are listening to.
Absolutely. So a lot of research was done after that, and that's when dry needling has come up. But I was very surprised when I came here about 10 years ago, and I saw that it was in full swing. I mean, okay. I had in 2010, I had not heard of many physios doing dry needling in India. But over here, the first thing that when I applied for the job, the first thing that my colleague said was, "We'll send you for a training for dry needling." So I was very happy, because being an acupuncturist, I was already doing acupuncture. I thought, okay, this is going to be a different kind of tool in my box, and I really mean this when I say that it is one of the best. For a manual therapist, it is one of the best, simply because it also saves your thumbs. So I would really say that please look into it. Go ahead.
So, brother, coming on to the technical parts of the needle, it comes in varied sizes. So, what is the size, and why do we use different sizes for different areas?
Right.
I'm asking the basic questions because let students understand everything about it, because we don't want to tell them about the rocket sciences and stuff, because we want to make everything easy.
Absolutely.
So why do we use different sizes of needles for different areas?
Well,
and what are the common sizes?
I'm just opening up the needles so I can show you what the sizes are. And these are the most commonly used sizes. Please don't get scared looking at this big one. So the smallest one here is a 13 millimeter, followed by a 25 millimeter. The third one here is about 40 millimeters, and this one is about 75 millimeters. That's about 7.5 centimeters. So depending on in dry needling, the size of the needle, the selection will depend on how muscular the person is, which muscle group you're treating. For example, this one, I would be using this for the glutes, because 3 layers of muscle, chunk of muscle, huge muscle. And if the person is really chunky and bulky, you will need a big needle for the muscle to be stimulated. The tiny one is for places like, the suboccipitals and the small muscles here, where you have to be very careful not to go really deep into the musculature, so that you don't hit the skull and the vital structures over there. So your skill, first thing is your skill will depend on your needle choice. I mean, you have to be very careful in choosing the needle properly. It depends on what muscle you're using, what muscle you're stimulating, and the size of the person. That is one thing. If it's a petite, thin person, you will use smaller needles, of course. And also part of the body, Like the chest and all, you will probably use the smallest needles.
Okay. So, brother, coming on to the next part, what are the indications of dry needling? Where do we use dry needles? What conditions do we treat with dry needles?
See, you can treat any kind of pain. First is pain.
Okay.
Any pain relief you need, you can use dry needles. Uh, Trigger points, which is the bread and butter
Trigger
of a
point.
massage therapist. To release the trigger point, needle, perfect. You get an immediate response. You get an immediate response. So pain, muscle tightness. Uh, you can use it for radiculopathy as well. There is two different theories of where you can use it. Now, one is the radiculopathy, where it is said that this is a it's a Canadian physician, Dr. Gun. He proposed the radiculopathy theory, which says that because it's mainly related to the spine, where you have the paraspinal muscles going into a spasm, and then it compresses the spinal nerve because the vertebrae are brought closer together, and the disc gets compressed. So the spinal nerve gets compressed, which causes radiculopathy. The peripheral nerve, which gets compressed or stimulated, will result into tightness of the muscle and trigger points in the muscle. So if you stimulate the paraspinal muscles and the peripheral muscles, you will get pain relief.
Okay.
So mainly
That's a good.
radiculopathy, trigger points, and muscle spasm. Of course, if it's in acute, if the patient
And
is in
and
acute type,
it happens in plenty. It happens in plenty. We have plenty of patients like this.
yeah,
It's like major chunk of our patients are low back pain patients,
true,
and most of them, other than the low back patients, we have the shoulder stuff, we have the neck,
true,
we have the radiculopathies, the tennis elbows, the
yeah,
tendinopathies, the
yeah,
biceps tendonitis, and all these situations in which we can use this dry needling.
true.
So next is I have noted down the physiological effects. We'll ask it later on.
Sure.
Brother, let's answer it right now. What is the physiological effects of dry needling? What happens when we insert a dry needle? What is the change in the physiology?
So when let's go a little bit into the trigger point pathology, how it happens. I'm going to explain in very simple terms how I explain it to my client, because that becomes a table talk. When you're doing the dry needling, you can say this to your client. It is very simple. A trigger point is a group of muscle fibers which are constantly contracting. Now, the constant contraction of the thing is because of increase in acetylcholine release and increase in uptake of calcium and all that. But all that is not useful to the client. So you just tell them that because of the constant contraction of the muscle fibers, what happens is the blood vessels get contracted, or the blood vessels get entrapped. So to that local area, there is ischemia. And also because of the ischemia, there is pain. There is also release of certain chemicals which stimulate the nociception. So the pain is because of those chemicals. When you put the needle in, people who do the dry needling, they will have seen that many a times, depends on the muscle. There are certain muscles which will give this kind of a response. Certain muscles will not show that response. It's called the twitch response. So the twitch response,
Right.
when you hit the trigger point, or when you hit the tight spot in the muscle with the needle, you get a twitch response. That's a sudden depolarization.
Right.
So that is one of the physiological responses. Again, because you're putting the needle in, it's a foreign body. There is very, very local contraction of the muscle fibers around the needle. Now, when again, people who have done the needling, when you twiddle the needle, when you move it, you feel that there is a resistance. The resistance is also because the fascial and the muscle fibers, they kind of entrap the needle, and when you twiddle it, when you move it, it kind of winds around the needle. So
Right.
there's one more technique. I'll talk about that later on. So the physiological effect is one, because you're actually causing artificial inflammation. You're increasing the blood flow. That is what we want. You're increasing the blood
Right.
flow because the nutrition and the oxygen goes up of the muscle. You're breaking the contraction because there is depolarization. So there's a sudden.
Right.
There is also a spinal reflex. The twitch response is a spinal reflex. When you hit that spot, the sensory nerve gets stimulated via your spinal cord, the motor nerve gets stimulated, and there is a sudden contraction followed by a relaxation. And relaxation is what you're looking for.
Right.
So
So you
mainly
are actually
relaxation.
artificially injuring that spot
True.
so that the body recognizes that there is something wrong in this area
True.
and it needs to be worked upon. So you are
True.
creating an artificial injury in an already injured part where
True.
the body is not putting any responses in.
True.
That's amazing. That's great. So, brother, do we have different angles? Because while inserting a needle, as we treat this mid thoracic areas, because underneath there are lungs, so there are very sensitive structures.
True.
So, do we have different angles for inserting needles? And what about the angles?
First thing is choose your needle properly, the size. There is no
Okay.
point choosing a 40 millimeter. Again, if the person is really very muscular and you see a huge chunk of muscle on their thorax, perfect. The front of the thorax, absolutely no needling, no intercostal needling, no needling in the front of the chest. At the back, the idea is to go as horizontal as possible. You can needle on the bone or on the cartilage. So you can
Okay.
needle on the rib. You should not be needling on the spine. Spine, as in the spinous process. You can in between the spinous process you can, but that's a Chinese acupuncture technique. So the idea is to go as close to the spine as possible, as horizontal as possible, and the direction of the needle should be towards the spine.
Okay.
That's because around your spine there's a big chunk of paraspinal muscles, the multifarididae and all that. So you are safe over there. You have very 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 limited risk of injuring or going into the vital structures. Again, I would
Right.
say if you're not experienced and if you're not confident, please do not needle structures like the serratus anterior, the lats, because they are very very quite thin muscles.
Right.
Uh,
And
Again,
they are
make
very
sure
close to the vital structures, can cause injuries.
can cause pneumothorax, if you go into into the lung.
Right.
And things have happened,
So
things have gone wrong. So it is better to be very careful.
yeah, better not to do it until you have not learned it properly.
Exactly. But you have different techniques of releasing those muscles. You don't need to use needles for those muscles.
Yeah, it's dry needling is a tool just like all other tools we have.
True.
It's a perfect tool. It's a great tool.
Yeah.
But like all other, I always use this example. If you have got Ferrari and you do not know how to drive it, you become dangerous and Ferrari is not at fault.
True.
So
Very
that is what I use for manipulation also.
true.
People say manipulation is dangerous, grade 5 is dangerous. I say if you don't know how to manipulate, manipulation is always dangerous.
Yes.
So any technique, even if you don't know how what the contraindication of shortwave diathermy is,
Yeah.
even shortwave diathermy becomes dangerous.
Yes. True.
So it's not about the technique; it's the person who is doing it.
Yeah. You should know
Brother,
when not
coming
to
on to
do
the
it.
next part, what is the time duration that we keep the needles inside that area? How much
Uh,
time we need to have? Is there any rule that you have to bring it out in 5 seconds, 10 seconds, or two
there are
minutes, 3 minutes?
there are people who will do it. They will just go in and come out. And there are people who will leave it for about 8 minutes because there is research which says that about 8 minutes. Now that is the overlap between dry needling and Chinese acupuncture technique, because Chinese acupuncture will leave the needle for a slightly longer time, depending on what type of effect you want. If it's about 7 to 8 minutes, it's a local effect. It's about 20 minutes, it's a spinal effect, and if it's more than 20 minutes, it becomes a central effect. In
Wow.
my experience is about 7 to 8 minutes. So what I do is I put the needle in. I'm still in the room with the client, and I finish my notes, and then I take the needles out. So about 3 to 4 minutes, 5 minutes. It gives the time for the client to also relax a little bit. But make sure you tell them do not move. For structures like the traps, the middle traps, if the client is trying to scratch or if the client is trying to move, there's a chance that the muscle might go into a spasm. So you also have to take into consideration that, okay, last time this client, the muscle went into spasm. I think we should not leave it for more than, a few minutes.
Okay.
Also, there is another thing which will decide this is the patient's response. There are some people who are really, really responsive and they become drowsy or they faint. So first thing is position them properly. Like all other techniques, you have to position the client properly. If you know that the client had fainted last time, please use less time.
Right.
So
So it becomes very subjective with the
it does.
response of the client as well.
It does. It does.
And we have to actually explain it to the patient that what we are going to do and how it is going to work, because
Yes.
communication is another part.
Complications. See, when you start doing dry needling, I would suggest there are I'm not sure, but I can forward the form to whoever wants it. There are people who would like everything written down. So to make yourself safe, just take a written consent. There's already ready-made forms which explain what amount of what percentage of side effects are possible, and you give it to them, let them read, let them go through it, let them sign it so that your back is clear. And then
Right.
even when you're doing your initial assessment, you can talk to them about it. So once you've done the signing of the consent and everything is written down, explain it to them that it doesn't happen very frequently. Like if I would say in last about 8 years that I've been doing dry needling over here, there's only one client who kind of was fainting on me. So it's not very, very common, but it does happen.
Right. To be on a safer side, you are a seasoned clinician, and now you are into so much of practice after so long. It happened once, and you were able to handle. But suppose for a fresher, it happens in the first day, first case. So it'll be
Yeah,
scary stuff.
that's a very, yeah, it's a
So
very,
talking to
you
the
don't know
patient,
what to
having
do with the first.
consent will be a best option for someone who is the beginner.
Yeah, yeah. So
Because
I think
communication is
beginners.
the key, and let me tell all my viewers right now, Dr. Manish and me, uh, we are connected since last 4 5 years, and he sent me a book. This is the gift I received from him. This is a book on NLP, neuro linguistic programming, coaching with NLP. He actually sent a courier, and Dr. Manish, thank you.
My pleasure.
We had a word, and we were talking about the low back pain, and this is one of the techniques called as the hands-off techniques, neuro-linguistic programming. Most of the people in the UK use it, and he's such a sweetheart that he sent a courier of this book, and I still have it, and I have it on my desk. So as to show
My
it to the
pleasure.
people that there are some great physios who want to share knowledge. And thank you so much, Dr. Manish.
My
I
pleasure.
never was able to thank you enough,
I'm
but
so glad
it's
you have it.
still on my table.
That's
So,
great.
brother, moving ahead, dry needling. What else? What are the contraindications? We talked about the indications.
Sure.
What are the contraindications of dry needling?
Again, you see, if you know that the client has fainted, try not to do it.
Right.
But if it's a new client, you will obviously do all your assessment like you would do for any other physio technique. So you will look at the skin. You will see that there is no signs of infection. Uh, Avoid it in the area of the tumor or a cancer if you see one. Like, but if
If
somebody has
there
a
is an history, or if you know about the tumors, it's a red flag for dry needling in that
it's a,
area.
in that area. But if there's somebody who has a history of breast cancer or is currently under treatment for breast cancer, and if you're doing the calves, it's all right.
Right.
It's all right. So
So
in the vicinity of the tumor, avoid it. But if you're doing it distally, where it's not connected to the pathology, you can still do it.
can we use dry needling for sprains or pain due to partial tear of ligaments?
You can, you can,
Okay.
you can. But I would say, if you're doing dry needling, the rule is do not go into the joint like anything else because it might cause infection and all sorts of things. Uh, there is no point in doing needling for the sprained ligament because again the ligament, no blood supply, no use. The needle is to be inserted in places where there is a good amount of blood supply. So you can obviously release the muscle. There is a technique which is again it's a Chinese acupuncture technique, but you can try it. It's called circling the dragon or surrounding the dragon, where if you have a pain in a local area and if you do not know where to needle, you can use 5 needles around that pain area, around the painful spot.
Okay.
Uh,
That's something very new.
that's a Chinese
Circling the
technique.
dragon.
That's a Chinese technique. So again, you will increase the blood flow in that particular area. You will inform the body that there is something wrong over there. Please pay attention to it. It's as simple as that. And there is pain relief. There is pain relief.
NLP book name is Coaching with NLP. I'll show it again. Coaching with NLP, because people are. This is by. This is the gift from Dr. Manish. So you can see it later on in the YouTube as well. You can check it.
It's available on Amazon.
It, but I was lucky one to get it from the master himself.
Unfortunately, I haven't written that book.
So it's amazing, bro. It's amazing. We are getting ahead with dry needling and stuff. So, brother, there is a lot of conflict in the earlier 2-3 years ago in India, that is dry needling the part of physiotherapy or not? What's the situation in UK?
It's the same over here. There is a big war, Cold War kind of thing going on between the Acupuncture Association and the British Acupuncture Association. So, Acupuncture Association of Chartered Physios is only for physiotherapists who are practicing dry needling and acupuncture, and the British Acupuncture Association is all the traditional Chinese medicine acupuncture practitioners. So they're both trying to claim their hold on dry needling. But I think there's a lot of research which is making it evident enough that dry needling has a very physiological basis. It is no way connected to Chinese acupuncture, and I think it should be the physiotherapy part is a little heavier, the side, because it's basically physiotherapy. It has a modern medical background. It's called Western acupuncture or modern medical acupuncture over here. So I
So
think
this might be happening with you people, that if you insert needle at a certain point and someone tells you that this is our point number 455, how and why you are inserting the needle in?
You know what? Fortunately, the client does not know whether I'm using a Chinese acupuncture point or a dry needling point. Fortunately, so I had this client about a few weeks ago. He comes in and he's like, I am happy to have dry needling. I do not want acupuncture. Okay. So I asked him why, and he said because there is no scientific evidence for acupuncture, for Chinese acupuncture. Perfect. So as long as the client is open, you can go ahead. You can do without telling the client. I'm not saying you're fooling them, because as I said, there is 70% of Chinese acupuncture points which coincide with our dry needling points. For example, the
Obvious. You insert it somewhere, they will name it. This is point number
exactly.
432.
So, also, when you document it, you don't document it as a traditional Chinese point. You put it down as a dry needling point. So you're safe that way also, and you also tell the client, okay, I'm putting it in your muscle, which is also a fact. So yeah, the war I think is going to continue. It doesn't matter. We need to do our.
Does dry needling has an impact in spastic stroke patient as well? Can we use this in a spasticity related to stroke?
Yes, but I think you know what, over there we need a central effect.
Okay.
Because the cause of spasticity is not peripheral now. It's more central. So you will have to use the needle for about 20 to 25 minutes, and you'll have to see what effect it has. So
Right.
yes, definitely. But in that case, I would say Chinese acupuncture points are more effective.
It's great to have someone who knows the Chinese acupuncture and is a physiotherapist and has a vast knowledge of other medical fraternities and fields, and he is also a dry needling therapist. So you are actually standing at the top and seeing everything happen in front of your eyes with so many things underneath your belt. So it
I'm
becomes very
just
helpful.
trying to give out the best that I can to my clients. Um, that's it. There's a question here: is it helpful in epilepsy? I think epilepsy, if it's a, uh, you know what, epilepsy, Chinese acupuncture is helpful in epilepsy. Yes. I'm sorry, I just picked up the question because I just saw it. But I would say avoid it in epilepsy. That's one of the contraindications, not an absolute contraindication, but a contraindication, because if you have needles in the gland and if the patient goes into a seizure, it's a bit tricky. So what you might do
Yeah.
is, you might use some traditional Chinese acupuncture points to just go in and come out, one needle at a time. But you'll have to monitor the client very, very closely.
Okay, bro. So, will you recommend certain books, or you are willing to take any courses in India? Because many people are actually uh, wanting to learn these techniques, these stuff of dry needling. So, are you willing, if I invite you someday after this Corona is over?
Absolutely.
Uh,
It'll be a pleasure.
Most of the students in India, they want to learn dry needling, and with
Absolutely.
someone like you having such vast experience and from different fields, it will be great for all of us to just share your stuff. Sir, is it
I'll be
helpful in
very,
cardiopulmonary conditions? I know people may ask anything,
that's fine.
but is it helpful?
Depending on what you're trying to treat. Now, for example, in cardiopulmonary conditions, if you're trying to, ease the client's breathing, so you might use it for the SCM, you might use it for the traps, relax the muscles, ease their breathing. Not for the condition per se, unless you're trying to do some Chinese acupuncture. So there are certain points.
So,
Yeah,
for the traditional Chinese acupuncture stuff, they have certain points for certain diseases.
yeah.
And they have particular points for those diseases where they use the needles.
Uh, yes, there are certain, these days there are certain protocols which have been published, but I would say it's like you have each case is different. There should be tailor-made points for each case, but there is a group of points which will be used for cardiopulmonary conditions or for heart conditions or for anxiety or whatever. But you have to pick and choose according to the client, because each of us is
So
different.
as a physio, we should be clear with this point that we are using dry needling,
Yeah.
and for dry needling, we have certain set of beliefs or paradigms that on which we need to walk,
Yes,
so as to keep ourselves safe,
true.
and not enter someone's else boundary.
Unless you're qualified, unless you're certified for it.
Unless you are qualified, you don't enter someone's arena
Absolutely.
and
Absolutely.
respect the professional boundaries.
Exactly. And today's day and time, it's always better to be safe, because if you do something wrong, or if intentionally or unintentionally, you might end up in a lawsuit or something. So you have to be very, very, very safe, very careful.
There is another, how do you decide which is the point for piercing needle, like according to the myotome, or is it basically on the depending upon the patient's question about where they are feeling the pain? Is it dependent upon the myotome or the pain?
If you're not able to pick up a particular point which is very tender, you can use the myotome technique. It also works. The dermatomyotome technique also works, but that's like you're just trying to give some relief. You're hoping that it'll work.
Okay, so you're
Ideally,
not sure about when you pick a myotome for treatment. You are hoping
no, if
something to
you're
work.
if you're not able to pick up a trigger point or a tender point. So what I do is, when, for example, if the person is coming with pain in the shoulder, infraspin area, that kind of a syndrome, referral down the arm, what you do is, when you do the assessment, you try to pick up the trigger point. You locate the trigger point properly, or let's say extensor tendinopathy of the wrist. we will go across. You will point to the area where you feel the trigger point, or you feel the difference in the consistency of the muscle. This is your palpation skills, and then you press on it, and then the patient will be like, yeah, that's the place where I experienced the most pain. The second question is, okay, is it sending pain anywhere else? And they'll be like, yes, it's sending pain down the arm or to the wrist or to the hand. And the third question is, if that's the kind of pain that you experience. And they'll be like, yes. Okay, so that's one point you have where you will be putting the needle in. Similarly, in all other muscles, or traps or whatever. So your palpation skills are very, very important, because
so it is important to have your thinking thumbs on every time. You have to have these tissue tension sense from where to recognize these trigger points.
Absolutely.
And can we needle in the scars?
In the scar, with what's the intention?
So if there is facial tightness underneath a scar, can we use needling techniques?
Around the scar, yes. Immediately
around the scar.
On the scar, no point. But around the scar, like I said, surround the dragon, you can put quite a few needles in, depending on the size of the scar. Leave it for about 10 minutes. You will see that the area becomes a little hyperemic. There is a little redness around the area. And then you can start your scar manipulations on the same day or the following day. It helps a lot. It reduces the manipulation time, the time when you want to release the tightness in the fascia.
Is dry needling painful?
Yes, but it's not extremely painful. Again, it becomes a skill, and also the type of needle. Use good quality needles, and it will not be much painful. It's not excruciating. It's like a pinprick, a small needle going in. Now the size of the needle is very, very thin. It's about 3 strands of your hair put together. So I don't know if I'm able to show you the
So brother, how do you determine the quality of needles?
Go for a standard company. That's what I would say.
Okay. If you try to bend it and then you try to straighten it up,
now there is one needle here in my hand. See, it's quite bendy, very thin.
Right.
Okay. The best thing is you need to do it on yourself and see. So
just check it on yourself, right?
Check it on yourself. Put it in. See how painful it is.
Wow. Thank you so much.
It's usually not painful. But yes, if it's a very, very sensitive trigger point, it will be painful, but it's good for you. You get a good feedback from the client. Yes, that's the point where it was painful. Put it in, twiddle it a little bit, get it out. You will get the result immediately.
Brother, can we do it on pregnant ladies, on pregnant women?
First trimester,
definitely. No. First trimester,
no. Because there is also autonomic response to the needle. So avoid the first trimester. In the second and third trimester, you should avoid the lower back and the sacral areas. The lumbar and the sacral areas are to be avoided, because those are the nerves that go to the uterus, and those are the points which are used to induce labor. So avoid those areas. But if there's a lady who is complaining of neck pain or calf pain or hamstring tightness or something like that, definitely go ahead and do it. But second and third trimester, yes.
Is it beneficial for treating piriformis? I use it oftenly, but
yes,
is it beneficial for treating piriformis band or the nodule?
Yes,
or that trigger point in the piriformis?
Absolutely.
This is one of the most common thing that I use for treating sciatica patients.
Absolutely. It's amazing. It's amazing to release the piriformis.
Right.
I think that's
so
the things that I do.
We are getting so much of queries, and it's like amazing to have so much of queries and questions, because people are participating in, and it's a wonderful conversation we are having right now on dry needling.
Thank you.
So, what are the checkpoints for doing dry needling? I mean, what are the go-to things, like if you observed a trigger point in that area, how to prepare the skin, because maintenance of hygiene is important in doing dry needling.
True.
So how do we do that?
See, again, there are.
So what is the basic thing that you actually do with every patient?
There are two schools of thoughts. Everything over here in the West is very, very evidence-based. So there's lots of studies which were conducted regarding this, and it was seen that there is no difference between using alcohol swab or gloves and not using those, or preparing the skin and not preparing the skin. What you can do is you can have a alcohol swab. You can use gloves if you want. You can use our good old alcohol swab. Rub the skin, let it dry, needle it, get out. Use a cotton swab again. If it's bleeding, just compress it for a minute or so and let it go. That's it.
So can we use it for frozen shoulder cases?
Should we use it for frozen
shoulder? Can we use it for the case of frozen shoulder?
Yes, absolutely. Absolutely. But you will not needle the shoulder joint per se. You will be needling the rotator cuff, you will be needling the rhomboids, you will be needling the traps.
The muscles involved in that area.
Absolutely. Again, you will see the tightness in the muscles, and you will locate for the trigger points. You will locate for the taut bands in the muscle, and you will trigger those. Target those areas.
So, brother, there is a common thing that we see, that most of the people after needling, they put the cups on and they just do cupping techniques along with the dry needling. So is it an add-on? Is it beneficial? What do you think is the history, and what is the motive behind doing so? Cupping along with needles. What is the effect?
You mean putting the cups on top of the needle?
Yes, some of the people do this by applying this needles. You apply the cup, and then they create a negative pressure so that the needle further goes down so as to go inside the muscle.
Okay, this is something new to me because I have practitioner, but
have you seen
I think I've not seen that being done. But I think it's quite risky because you might push the needle further down where it is not needed. So I would say if you want to do the cupping and the needling together, do it one after the other. Do the cups, then
you just pull out the needles and then you apply the cups.
Exactly.
That's much better.
Exactly.
Right.
Because so, I think the physiological effect of both of them is quite different. Yes, it shares that it causes hyperemia and all, but cups would be mainly to stretch the structures and to stretch the muscle and the fascia and everything. The needle is mainly for getting the relaxation in the muscle and trigger pointing.
Can we use it in dry needles on TMJ?
Again, the joint per se, no, because none of the joints are supposed to be needled. You cannot go into the joints.
Right.
For the muscles, so you can use this for the masseter. You can use it for the temporalis. Definitely, yes.
Does it help when the jaw locks? See, Dr. Manish, there are many cases, many questions like, can we use it on locks, or can we use it on joints? So we always needle the muscles, not the joint. The cases you ask is, can we do it for TMJ? The answer is no, but you can, if you ask, can we use needles for masseter? The answer is yes. So it's not the joint that we are going to needle. Be very clear with this.
Yeah.
It's the muscle that we needle. Yeah. So there is another tool that most of the clinicians are using, putting onto the electrodes with needles. They use this small electrodes and that tense kind of a thing after
Yeah.
inserting the needles.
Yeah.
So what is it?
That's electroacupuncture. I find it to be very helpful in tendinopathies.
Okay.
And also, again, if you have a paralysis in a muscle or a paralyzed muscle, for example, Bell's palsy or something, you can do it on the facial muscles as well. So you put small needles into the facial muscles. Again, you should know where and which ones to needle, and then you can connect it to the electrodes to stimulate the muscle. Or basically, many cases they will have a recovery on their own, facial palsy, Bell's palsy, and all. But the length of the time that it takes, sometimes the muscles become fibrosed. So for the muscles to be kept alive, you have to keep the muscles going. The patient is unable to contract them. This is one of the ways of contracting the muscle, where you keep the muscle alive and ready for the nerve to get healed, the innervation process.
Right. So
So
until there is nerve that is being injured is recovering, you can keep those muscles active.
yeah, to avoid the fibrosis in the muscles, and to give them some form of exercise 2 or 3 times a week.
So what is the frequency in which we can use drag needling? So how is it about the regularity of patients? How frequently do you see a single patient in a week, or you see him twice, or because it's a lot different in India. You see people asking patients to come regularly, day after day, day after day. It is not actually happening in the West. They have different appointments twice a week or thrice a week. So
Yeah.
how often do you see patients in UK?
If the condition is extremely severe, extremely painful, the max would be 3 times a week. Max. I mean, there would be hardly 1 or 2 clients in the whole month which would be coming 3 times a week. It's usually two times a week or once a week.
Usually 2 times a week or once a week, and very rarely, very severe cases,
Very
3 times a week.
Yeah.
So do you needle them? How much area can we needle? Because there are patients with fibromyalgias having multiple trigger points in every part and corner, nook and corner of their body.
Yeah.
So how do you proceed with these patients having multiple areas of pain and having multiple trigger points all over the body? So how much needles, how much stuff that you can treat in one session?
The maximum number of needles that I have used in one go is about 24.
Wow.
But that's again a very, very rare occasion. I think, in like you mentioned, in conditions like fibromyalgia, there you have to pick up what is more problematic, what is more severe. For example, it's the upper quadrant or upper half of the body. So do upper half of the body one day, do lower half the other day, because it does cause soreness. It can also cause bruising. It can cause a little bit of bleeding. And the patient becomes a little scared, little nervous about it initially. So I would say, take it easy, go slow, uh, do one part today, call them after 2 or 3 days, do the other part, or even the second day. It doesn't matter, because if you're doing the upper half today, you can always do the lower half tomorrow. But it does cause a little bit of soreness, little bit, which is not even like DOMS. It is even less than that.
Right. So what advice do we give uh, to the patients after a dry needling session? Say you have completed the dry needling session right now, and what are the advices or what are the messages that you give to your patients about the pain, about what they should drink, or how much time you want to rest them in the clinic, or you just send them off? Is the or is it depends upon the patients as well? what kind of messages you gave after that session?
Anybody who gets off the couch, you tell them, okay, come off very slowly. You might feel a little dizzy or a little lightheaded, and it's absolutely fine. Make them sit down. If they need a little bit of water, give it to them. Ask them not to straight away go and drive, just walk out of the clinic and drive. Ask them to sit down in the reception area, have a glass of water, or just relax for a couple of minutes, 5 minutes, and then they can carry on with their activities. Tell them that there will be a little bit of soreness, not to worry about it. The puncture site have it could cause bruising. There are certain areas of the body, or it depends on very it is very individual whether people will bruise. It varies from person to person. For example, the area of the IT band, that's one area which is definitely going to bruise in almost 90% of the people. And some people do get really scared. If you don't warn them that, okay, this is going to be a big bruise, they get really scared because it's like somebody's beaten them. It's black and blue all over. So you give them the advice that, okay, it's going to bleed, or it's going to bruise, don't worry about it. And they can put some ice on it on the day of the treatment. No heat, because you've already increased the blood flow. So no heat, just icing for about 10 minutes, the regular what advice we give, and just ask them to drink plenty of water. That's it.
Right, bro. So there was one question that went up. It was how long effect stays in fibromyalgia? Can it be completely treated? Uh, Fibromyalgia is let me just answer it, bro, because I want to answer it the first part.
Sure.
Fibromyalgia is something that is related to sometimes the genetic background as well, and there is a lot of research is going on that it is linked to protein that is known as the fibrin F. So fibromyalgia has multiple diseases and backgrounds which comprises of that disease. So it may be the psychological factors that is predisposing that patient to fibromyalgia. It may be physical factors. It may be lack of sleep. So just doing the dry needling, yeah, a patient is under a lot of stress. He's not sleeping properly. His diet is not adequate.
Yeah.
There are anti-inflammatory. There is inflammatory reactions all over the body, and the muscles are showing that symptoms. And those trigger points are dealt by needle.
Yeah.
But still, the patient has to focus on a lot of other things as well. Adequate diet, anti-inflammatory medication sometimes, adequate sleep. So dry needling is one part of the story in which you relieve the trigger points using those needles. Uh, Apart from it, aerobic exercises have proven to be very beneficial. But in order to make a patient exercise, you have to make that patient free of pain. Otherwise, he is not going to move. If he is in pain, he is depressed, he is not sleeping properly, how he will adhere to your advices of getting active and going to the gym? So he will only follow your advice when you help him in his pain. So as a physiotherapist, first responsibility is to reduce the pain and make people comfortable, and then guide them out of their pain using all these active exercises. So it's one part of the story. That's what I feel. Sir, you can answer this.
I definitely 100% agree with whatever you said. I think it's important to have a multidisciplinary approach in somebody who has fibromyalgia, because there are various factors. There's no one reason why somebody has fibromyalgia, like Dr. Sharma said. It's very important to get into a team to help such a patient. Yes, your dry needling will definitely help reduce the pain, but there are other factors which need to be addressed as well. So,
can dry needling show immediate effect? If so,
yeah,
we can use them in sports during matches.
Yes, absolutely.
As a sports physio working with BCCI, I use dry needling a lot. My players love it. I have done it on Virender Sehwag. I have done it on Gautam Bhai. I have done it on Ishant Sharma. I have done it on various Ranji players. I have done it on Maninder Singh Paji. So I have done it on so many cricketers.
Amazing. I think those people can be those great players can be brand ambassadors for us to to promote dry needling in countries like India. It's amazing.
They actually are promoting physiotherapy, bro. I received a message 2 days back from the great Virender Sehwag, and he thanked all the physios for the work they are doing in the COVID-19 crisis as well. Most of the physios are doing amazing job in India. They are in hospitals, in clinics.
Hello.
So it was 1 hour, bro.
Yes, I
That's why we just had to. I don't know. It finished. It went so quickly. It was so
know. I
interesting.
just looked at the clock and I was like, wow, it's already an hour.
Thank you so much,
My pleasure.
sir, Manish sir. It's a pleasure to have you with us. It's such enlightening experience for all the listeners who want to do or learn dry needling, and they know how and when to start with dry needling. So it's I'm immensely thankful to you.
My pleasure. Thank you so much. Thank you.
So I just want to finish this talk by your concluding remarks. What are your remarks about the dry needling? And next we will ask you about how to relocate, because I promised that
Sure.
in the end I'll ask you this question.
Sure.
So let me just ask this question first, and then you give the concluding remarks. So,
Okay.
brother, if any physio he wants to go to this question has already been answered, the rotator cuff injury one. So I'll ask about this. If someone wants to relocate to UK, so what are the checklists that one needs to do? What is the requirements?
Right. So if it's somebody who already has finished their undergrad in India, uh,
Yes.
from September 2020, the UK government is going to start the post-study work visa, which is a 2 years visa after you finish your master's degree in the UK. And those 2 years will be enough for you to locate or to get a job and to do all the other formalities. The best thing about UK is you do not need a license. When you finish your studies in India, you can directly come and work over here.
Okay.
All you need is a IELTS exam to show your proficiency in English language, and you do not need a licensure exam or nothing, whatever is needed in Canada and the US. So that's one plus thing. The most important thing is you will need a sponsor. Now, what I did was I finished my undergrad, and then I came here for my master's degree, and I finished that from Oxford Brookes. And then after that, I was given this job, and the company sponsored my visa. So you will need a sponsor for at least 5 years, because that's what you need before you become a citizen, before you become a person with indefinite leave to remain in the country. That's as of now. Things might change. Who knows? COVID is changing everything. Uh, there could be since there's also Brexit, which has happened last year. It's not completely, it's not done yet, but hopefully after 31st of December 2020, since the rest of the world will be at par with Europe, there'll be more opportunities, I guess, because the European physios will not be allowed to come to India, or they will have to fulfill all the criteria like the Indian physios will have to do, or any other physio around the world. So I think it'll be more opportunity for people from India.
It will
Uh,
be equal opportunities.
yes, absolutely.
Right.
And uh, so if there's somebody who's done a post graduation in India and they want to relocate, and they will have to find a sponsor. So it'll be either
Right.
the national health or a private company who is ready to sponsor them. So
Right,
the
bro.
keyword is sponsorship. You do need a sponsor. If you want to spend some money and come and do your masters over here, after you finish your master's degree, you have a 2-year period where you can find or can see if you get a master, if you get a sponsor.
Right, brother. Thank you so much.
So,
thank you so much.
my pleasure. But right now, I think for physios, it's easier to go to Canada. Just apply, get a PR, and go and do your work over there.
Thank you, bro. Thank you so much for such enlightening session. And we will love to have you after this Corona is over, COVID-19 is over, and we'll have you in India, and I'll definitely work out things with you so that we can organize your dry needling stuff in India, and it will be a pleasure having you with us. Thank
you
you,
so much,
listeners, for joining in. With next announcements about the Physio Samvaad episodes, I'll be announcing them. Thank you once again, Dr. Manish. It was a pleasure to have you. Thank you so much, brother.
And thanks to everybody for taking time out. Thank you. Thanks for the opportunity.
Thank you. Thank you, sir.
Have a good evening. Bye.